Good afternoon. Welcome to the first CCHCA Leadership Symposium. 2022 is our CCHCA 40th anniversary. So who is CCHCA, right? So we are a nonprofit independent physician association dedicated to service of the San Francisco community and beyond since 1982. So this leadership symposium, it's dedicated to nourish leadership skills and development in community health. So we are having a 5-leader panel discussion for the first hour. So I am very, very excited to hear a few of our CCHCA grant recipients and executive leaders, and they will share the best practices in promoting community health. So the panels are Georgechan from Newcomers Services, and Wen-Wen, she's a professor from San Francisco State University, and michaelliao from NICOS, and sarahw from CYC. And we also have Catherine.wong from San Francisco Department of Health. She can't make it today, but we will show her video recording as part of the symposium. So as a community leader and managing the health education content, I would like to briefly share how our team to promote health initiative through the digital marketing. So Eric, would you mind sharing the screen for me? Thank you. So yeah, so we have a very good group today. So just a few months ago, we partnered with some self-help for the elderly to increase the awareness and increase number of people complete the advanced directive in our San Francisco senior community. So I would like to show you how we leverage an unconventional way, which is very cost-effective strategy, which is called digital marketing to reach our target audience. Next slide, please. So you might ask, how's the digital marketing work? So here it is. So we basically leverage the YouTube videos as well as coupling with the Google campaigns. So basically we using some fund to run Google campaigns, and through that targeted audience that we actually set up, and we draw our audience and then on the page, which is considered a funnel page or a landing page, that we attract people to learn about what we have to offer. So we have very good copywriting here, as you can see. So we actually try to attract bilingual individuals. So we have a bilingual page, and so it's very specific and hook them so that they wanted to learn more. So they were likely to the people who have the need, and then they will click on the page. So next slide, please. Thank you. So we also have some games. So we increase engagement by set up a quiz. So and helping those individuals to think through what they have on this topic. So to get them have a deeper learning through the quiz. So after the quiz, we develop this content to help them understand different categories. So to assess their readiness, to understand where they are, and help them to move their readiness to a more mature level. So ultimately, if they felt that they really have the need, then this will land on the booking page, which is the page that they can put in their information so that our representative can call them. Next page, please. And we do that. We actually created 23 video campaigns and a few 17 landing page. The reason doing that is we fine tuning by looking at the data that from Google Ads. So they give us numbers, so we learn from the data. So through analysis, we twist the video as well as the landing page. And it's true that you might ask, like, oh, a lot of senior Cantonese speaking senior may not even know how to utilize, the pages, website pages. So we actually aware of some of people like that, and we actually twisted those information by making it more simple, meaning we just give them a phone number so that they can just call. So we try to be adaptive. Next page, please. And we have, this is sample videos that we create to create that engagement. And because of time, I'm not going to play all the videos, but those videos should be on our website as well. Next page, please. And here's just an example of the landing page in the largest screen. So we set up the age group we want and highlight what they actually most concerned about. And this is just one of the landing page. Certainly everyone's concerns are different. Everyone's pain point is different. So therefore, we value everyone. So that's why we have different landing pages. Next page, please. And here's another one. So people may concern about, earlier it's about the kids, and the next one, some people may not worry about kids so much. They may worry about the dignity. So here's another landing page that we set up for different people's needs. Next page, please. And then here's another simpler one. It's just like, directly, like if you have the need, just fill out a form. Okay, next page, please. And here's the educational page. So it is true that some people are not ready to do anything. They just wanted to learn more, right? So we actually had a very, very simple, right? It's a small, almost like a web 1.0, right? Just informational, just read only, no interaction. And earlier what you see is web 2.0. So you can interact, right? Okay, next page, please. And here's some more landing page fit on the web 1.0, like just information they can browse, learn more. The next page, please. And doing that, what is the return on investment here, right? So basically, we have gotten the impression, like over 1 million impression. So believe it or not, in San Francisco, we have about 180,000 Chinese-speaking elderly. So actually 180,000 Chinese residents living in San Francisco. So out of that, there are about 20% are elderly. So 1/5. So you see that it's the impression, seeing all those ads that we have. It's great. People see it multiple times, right? So in terms of interaction, what does that mean? It means clicks, engagement, and views. So and views meaning they watch over 30 seconds. So you see that it's 200, over 1/5 a million. So it's pretty significant, right? It's almost cover the entire San Francisco Chinese-speaking population. It's pretty good. And then for landing page, and we have almost 5,000, meaning people actually land on the page and learn about what we have to offer. And those are part of our outreach to reach out to people we really targeted on and encourage them to learn about what we offer. And why I'm sharing all this to you is really to help one another, maybe to create a discussion. And here's one of the many ways that we promote our health initiatives. And it's true that traditionally we do workshops, partner with different organizations. Those are very, very good, but it's harder to scale. And there's one way that we learn. It's one way our team learn. It's a good way to scale. And feel free to talk to me if you're actually interested in learning more, and we can have a deeper conversation. Thank you. So without further, you can actually close it. Thank you, Eric. So now, the next, so I'm just one of the leader, but I'm actually wanted to introduce the next panel speaker, Georgechan. Hi, George. welcome. Georgechan is from Newcomer Service, so his team has done fabulous work for the community. I can't thank enough for his team serving the newcomer. I was one of the newcomer like 20 years ago, so I really enjoy working with this, this community. So George, you can take it away, and you will be talking about recruiting volunteers, right? Retaining and recruiting volunteers. It's a very important topic for nonprofit. So you can take it away, George.
Thank you everyone, and good afternoon. My name is Georgechan. I'm the Executive Director of the Chinese Newcomers Service Center. I would like to take a few minutes to introduce our organization first, if you don't mind. So let me share the screen with the PowerPoint. I prepared it. Let me know if the screen doesn't work, and I will reshare it. Please let me know. Okay, so let me see. Chinese Newcomers Service Center, we are located in Chinatown, San Francisco. Our major target is the Chinese-speaking Chinese immigrants or the Chinatown residents. So our goal is to help them to adapt the life in the United States, help them to achieve the American dreams. So I would like to highlight some of the programs we did in 2022, and then I will explain why volunteers is very important to an organization. Okay, so the first project we have, I want other than Facebook or the media, we promote the Chinatown business to the visitor during the Chinese New Year. So we have to cooperate with different agencies, including the Chinese chambers of merchants, plus the merchant in Chinatown. So that is a big project, and of course we have to work with cooperate with some artists to create artwork as well, and even just posting the artwork to those stores, we need to cooperate with different people. Highly relied on those volunteers to help out. And then next program also related to the volunteers is about the free tax assistance. So one of the signature program in Chinese Newcomers. We have different programs, including the WITA, TC, or LITC. The volunteers here, we mentioned we have to educate them to how to help other people to do tax return. So it is about the basic knowledge is involved. So there's a little bit different on general volunteers. So there's some requirements. I will talk about it in a few seconds. For the tax service, we help 3,800 families to prepare the tax return, and we have already claimed back 3.7 million of tax refund. So those work count on the volunteers. And see, some of them they're tax lawyers, some of them they are embedded agent, different professionals. And we also have other hands-on assistance, like helping them to apply jobs, apply benefit. They are all time consuming. So if you count on your staff time will be very expensive, and then you count for our budget for doing those. So also we need a lot of volunteers to help. And then next item will be the return to work program. So even those job seekers, they are very excited to get into a new work, but they need advice. So different kind of advice, like a dressing code, and maybe some consultation on how to pick a job, or how to even create an account to apply job online. So they are all related to volunteers work. Next will be the keeping Chinatown clean. So we have a team of street cleaners cleaning the Chinatown every day. But during the festival, like the upcoming Chinese New Year or the past Mid-Autumn Festival, we help the street keeping them clean during the street fairs. So they also need some volunteer to help us to report where is the garbage or something like that. So also about volunteers. And next item is about safety. During the Asian hate crime season last year, even early this year, we partner with other merchants or the neighborhood to kind of create a network, help us to watch the labor. If we see something, we say something, and call police right away. They're all volunteers. And also, we found a very interesting volunteer with a expertise. So he is a Kung Fu master, and he is willing to educate our new immigrants to have a self-defense class. So also about volunteers. And then next will be the civil engagement. Sometimes I want to mention volunteer doesn't mean individual. Sometimes maybe a whole organization or even a government agency. So I will talk about it later. We did partner with some Department of Election of San Francisco and do some outreach, and it was fun. And of course, talking about agency as volunteer, we also partner with different organizations like AAMG to help with the education, health education. These days we have a lot of health topics, and we are not experts, so we do need someone good in the field, and then talk about it to educate our audience or the target clients. And also about the newcomers orientation monthly. Talk about the health issue, health topics, outreach, everything. And then last but not least is about the food drive. Food drive is a big event. Every day, every year, we have a food drive. Give out 5,000 food back to the low-income families in Chinatown or the Chinese immigrant. So it is a lot of work, whole day event, one day event from early 6 o'clock to late evening. So we do need a lot of help from volunteers. So now let's get into the topic. Recruit and keep volunteers for the project. So if you don't mind, I use this picture because volunteers, I treat them as a family and then a band of brothers. Okay, of course, sisters. So today I'm going to focus on three major items. The first one is how to recruit. Second is what is the right volunteers for you, and then the third one will be how to keep them. Okay, so I'm going to show you some example we have, and then to display how we can keep our volunteers or how to recruit them. The first example is street cleanings. So you know how to during the pandemic, even before the pandemic, cleaning street may be some of kind of like a dirty work, and how do you recruit people to do it, or what makes them to be a white candidate for you? So our strategy is to announce that okay, so we are going to clean Chinatown, which is your neighborhood, which is your home, and then we share the common interest. So we try to persuade them to join us, and there's always some surprise. So and eventually we did have the mayor come down and then work with us. So when we share the common interest, share some surprise with them, and then we did recruit some volunteers. And then I want to mention there's no right or wrong volunteers. Sometimes it's how do you use them. So for example, some of those volunteers, they are not really good at English or maybe even Chinese speaking only. But they are good at handiwork. If you can assign them a white job, white work, they are good candidates. They are good volunteers. Okay. And then next example is about food drive. It is a big event, 5,000 food bag we pack and give away in the same day. So we do need a lot of help. So at that time, we don't choose, we don't be picky. So you just use whatever is available. And then and you see that in the picture, you will see some old folks. They can only do light works. You give them light work to do. If you see someone is strong enough, you ask them to be the security. So again, there's no right or wrong. Depends on how the manager, how to use those volunteers. Okay, another picture showing the volunteers. You see the old folks, if they can do only light works, let them do only the light works only. And so if they need a break, let them take a break. So the manager will take the very important role on the event. And the next example is about the outreaches. So we seriously do a lot of outreach in person or we assume virtually. When we do in person, we do need some muscle. So we will ask volunteers to help us to move all those outreach material or setting up the booth, setting up those things. So to do this, we always ask anyone is willing to help, and then maybe after that we buy them lunch or buy them some tart or something as a kind of a treat for them to help. And the next picture is showing the Facebook project I just mentioned earlier. So in some cases, volunteer may need some the interested party, like the Chinatown promotional project. So we do partner with the local merchants. We talk to the boss, we talk to the manager, or we talk to whoever is watching the store to inform them, hey, we need to set up something. Do you mind I do it on certain day? So it's all about communication. You cannot just show up and kind of like work with them and make them feel they are part of the project, to be the volunteer of the project. So that is some example about partner with the local interested party. And then next item is ID expert. Okay, so we are somewhat lucky. So we do try to ask different people to help us. So this group of people, they're from UC Berkeley IT students. So we ask, okay, hey, we need some help. Are you able to help or something? Do you interest to help with us to develop an apps for Chinese newcomers? And then it's a surprise. They like our idea, and then they accept the task. And then this whole group of people, they're young, they're professional, and they are committed to help us to develop an app. So it's in under development. I hope I can show you here, but they show me some screen shot already. It looks like very good. Hopefully it will be out there by sometime spring 2023, something like that. So don't be shy to ask. Sometimes you ask some good people as a surprise. Okay, same thing. When we ask, okay, we need to do outreach for the election, and then we are not experts, so sometimes we need some help, and then we ask the professional from Department of Election. So they did send a team, and then they come down here and explain a lot of things. So it's a good strategy to partner with even organization, agency, something like that. Okay, so the next important point is you treat them as good as your family members. So they volunteer for you, they don't get paid, they just want to be part of your project. And then if you make them feel good, they coming back every year. Some of our tax volunteer keep coming. Some of them, they come here for 40 years, even older than me. So the sense of belonging is very important to keep your volunteers. So that is some project we share. Okay, another example I want to show is good news brings in good people. So you see the pictures every year after the tax season, we hit the goal. We spend a lot of money on those volunteer parties. You see a whole xiuju and also the cake or everything. All you can drink milk tea. Can you imagine that? Okay, so but they like it. So good news brings in good people. And next item. Okay. So and also share the joy. Sometimes you want to be have the sense of belongings. So you need to work with them, pay with them. So happy hours, bringing them out for events like watching a ball games or something, party would be a good idea. So sometimes you see I'm crazy out there. Okay. So I think almost one was time. So let's join the jump into the conclusion. So in conclusion, there's no right or wrong volunteers for your work. So depends on how do you use them. And then secondly is sometimes you may want to share your common interests with volunteers. You have a same goal, work together in an effective way. And then next will be don't be shy to ask professional and partners. Sometimes you will get something you don't expect. Great result, great returns. And then finally, treat them as good as your family members. Again, good meal brings good people. So I think my time is up, and that's all of my presentation. Hope you like it.
Sounds great. Thank you, georgechan, for fabulous presentation. So I have a lot to take away from you, and treat your volunteers like family, encourage them and help them to do what they can do. So the next would be Wen-Wen Li. So Wen-Wen is a nurse, a professor from San Francisco State University. So her topic is get projects published and disseminated. Very, very important topic. So you can take it away, Wen-Wen.
Okay, thank you so much. For some reason I cannot share my screen. Oh, no, I can share the screen right now. Okay, here we go. So everybody is able to see my screen right now?
Yes, definitely.
Okay, great. Yeah, so let me enlarge that one. Okay, good. Oh, and thank you so much for this important leadership symposium. And Esther, this is such a wonderful opportunity for us to be able to interact with the other the team members. This is wonderful. And thank you so much for the assignment to present on the publication dissemination. I know lots of people do not like to do this type of project. Like if you want to publish, you want to disseminate, actually that require extra efforts. So, but I do encourage, the our team members to publish, because like George just present a very important project, and if we can get this published or disseminated to the public, that would be wonderful. So what I would like to present, and I'm the professor from San Francisco State, so I have because being a professor, publication dissemination of my research finding is the must be for my job requirement. So I publish in the project and disseminate my study findings all the time. So what I would like to share with you guys is, let's say if you really want to publish or disseminate your research project, then there are several requirements that you need to put into your research project. So those would be the essential elements that you should consider. The first usually is about introduction, like what is the literature review about your project, why your project is so important to the community. And the second, definitely we need to have specific aims. Okay, so you need to talk about, okay, what do you want to achieve? Okay, so for example, I would like to help Chinese immigrants improve their hypertension management, high blood pressure management. So that would be my specific aim. And then you also need to talk about the study design. So what kind of study design? And I know relatively this is a complicated topic. So I would encourage you guys, if you have a chance to work with academic people like professors or researchers from academic setting, they can help you to design your project. And then next one is the method. Method can include lots of different things, but actually don't think this is really threatening, because whatever you have been doing, actually you cover everything already, including where do you get your sample and where do you do your project. What is your intervention? What is the measurement? What usually we talk about measurement for the outcome. So for example, I have been studying, hypertension management in Chinese immigrants for many years. And then blood pressure is the major measurement that I need to talk about. What kind of device I use to measure? I use to measure blood pressure and etc. So measurement is also the must be, and then study procedure, the project procedure, and you also need to talk about data analysis. And afterwards, of course, after we collect the data and then we need to analyze the data, then that comes with the result. And result is the major finding for your research. So what is the big endpoint that you get? Okay, so for example, I give the technology-based intervention, and the patient's blood pressure in average, we talk about in average, got improvement in terms of systolic blood pressure, 10 mmHg within half year. Really good. So that is the main result that you should present. And then that is very important to discuss. Okay, what does your result mean? Okay, does the 10 mmHg is a lot within the half year or not enough? And how about compared to other literature. Okay, so that is all we need to discuss in that section. And then finally, because we all hope that our research finding would be able to apply to the clinical setting. So we also need to talk about the clinical implication. So those would, let's say if you would like to disseminate your study finding in a conference or publish your paper in a journal, those would be the requirement that you need to consider. And the next one would be, okay, let's say if you really want to publish or disseminate your finding to the large audience, and then you need to have IRB approval. So IRB, what is IRB? I think you heard the term of this term already. It's about the human subject right. So whatever research or research project that you would like to involve human being, you need to get approval. Okay, and the approval is to make sure you do everything ethically. Or you talk to your participants and you do not increase their, the mental burden or physical burden and etc. So those would be the IRB approval. And where can you get the IRB approval? So let's say if you work in your institute, and in your institute, you have the IRB approval. So for example, Chinese hospital, I think a Chinese hospital, they have their own IRB committee. So let's say if you work in Chinese hospital, we collaborate with the people from Chinese hospital, you can get the IRB approval from Chinese hospital. So that is where you work, or from the clinical side. So those would be the things you can get, the place you can get IRB approval. And for me, because I work for a university, so our university is the huge university. We have 30 campuses. So we do have our IRB committee, which we can get IRB approval, okay? And then I would like to share with you my experience, because it takes time to get IRB approval. So don't feel discouraged when it takes time, and the IRB committee would like you to do this, to do that, back and forth so many times, and don't feel discouraged. You just comply to whatever they require. And usually they would do you a favor, because what we would like to do is to improve the health outcome for the population. That is a good purpose. So why do they stop us? There is no way they would stop us unless there is very serious ethical threatening issue. Okay. And then I would like to talk about the project implementation after you get your IRB approval. Those are what you need to do. So this pretty much align with I talk about the project requirement. So usually you need to have a data collection. You need to collect the data, like Esther talk about her data collection, and it could be online and etc. So the number of data can really depends on is number of participants or number of entries. That really depends on the measurement or outcome that you would like to target. So data collection is something you need to do, for your study project, and that you would be able to enter to the next stage, which is data analysis. So after we get data collection, we need to start analyze our data. Data analysis really depends on what is your specific aim. Okay, so again, let's say if I would like to see if my intervention can help patients achieve better or optimal hypertension management, then that is my specific aim. I need to talk about, okay, how much blood pressure you have achieved after implementing your intervention for the patients. So that is data analysis that you need to focus on. And then I talk about this already, data interpretation. 10 mmHg systolic blood pressure improvement, does that mean a lot? Does that, is that meaningful in the clinical implication? And usually for this part, including the data interpretation, discussion, and implication, we need to work with clinicians. And myself is the researcher from the academic setting, but I also need to make sure that I work with the clinicians, the RN, the MD in the hospital and in the clinic, and make sure my data really makes sense. So that is the project in implementation. The next one I would like to talk about is for both is dissemination and the publication. So in terms of the dissemination, I think that this is a good venue. Esther provide CCHCA, Esther provide a really good venue for us to share our experience. But I also encourage you guys, if you have a bigger, target, like you would like to disseminate your research finding, and in a national level or international level, I would encourage you to choose a conference to present your study findings. Again, because that way you can reach a larger audience and could be nationally or internationally. And then that is about dissemination. For the publication, this publication usually is publish your paper in a journal. And why we need to publish a paper in the journal? Because the journal, the publication, your paper can be searchable everywhere in Google Scholar, in all the search engine, the government search engine. Let's say if the researcher type in a keyword, they would be able to look up your article, and then they can cite your article in their paper or in their study. So that can really make your study disseminable in a very long term, not just 1 year, 2 years, but it could be up to 10 years, 20 years. And so that would be very beneficial. And then, of course, in order to select, the conferences, the journals, if you are beginners, then I would encourage you to work with an experienced academic faculty to speed up the entire process. And then I have a talk about all of those already, but let me give you a little bit more detailed information. So presentation in conferences, usually you would also get a feedback from audience, and those audience, let's say if you present your research finding in a national level, you get a national audience. And in an international level, you get feedback from international audience. What is the benefit for that? First, they can give you the different perspective to interject to your project to improve your project in the future. Second, there is a possibility that you can have a collaboration with them. So for example, because I usually present my research finding in international project, and then because originally I come from Taiwan, so I have been working with a lot of Taiwanese scholars, professors, researchers in Taiwan. For example, if I do a research here, I duplicate, everything is duplicated in Taiwan, so I can do the cultural comparison. So that is the beauty that we can make our intervention, make our study more robust. So that is the purpose for dissemination. And the publication, I also briefly talk about this already. And more things I would like to touch base on is that publication really takes time. But don't feel discouraged. Eventually that would get there. For the experienced researcher, it's about 2 to 6 months, okay? And then, but for the first timer beginner, it can take 6 to 12 months. Let me share with you my experience. When I was a doctoral student, it took me 2 years to publish one article. And I really want to give up so many times. If not my advisor keep encouraging me, I would just give up, because 2 years, how many 2 years you can wait, right? So how many 2 years you have in your life just waiting for one thing? So that can sometimes be very discouraging. But once I get that first manuscript published, afterwards I really know how to publish my paper in a journal. And usually right now it's takes me, really depends on my situation. It can be like 2 to 6 months, and now I become like the expert. I even serve as a reviewer for the different journals. So I have been serving as a reviewer for like more than 10 different kind of journals, and I also serve as editorial board. So editorial board is I try to recruit papers or whatever. So let's say if you would like to publish your work, contact me, because I can help you talk to our editor and have your work published. Okay, so that is everybody can publish, can disseminate. So everybody, please do it if you can. And this is my contact information. If you need to contact me, this is my email address. Thank you so much for the opportunity to present this, to share my experience. So thank you again.
Thank you so much, Wen-Wen. You have given us a lot of golden nuggets for getting the project published, and you share how and why we could disseminate our publications. And Wen-Wen is truly an expert in terms of getting paper to publish, and you can contact her so she can be a great editor. So the next speaker would be Michael-liao. He's director from NICOS. So you can take it away, Michael.
Wonderful. Thank you so much. I'm going to share my screen. Okay, here it is. So thank you so much for having me. Sorry. Okay, there it is. My name is Michael-liao. I'm the Director of Programs at NICOS Chinese Health Coalition. And I really appreciate the opportunity to hear from our other community partners and leaders. And for us, we want to be able to share our great experience working with CCHCA on an AAMG on getting our God Game project funded, and it was a very community-driven, community-led initiative. So I'm sorry, give me 1 second. And so I wanted to talk about how we develop our God Game project. So NICOS first, our mission is to enhance the health and the well-being of San Francisco's Chinese community. We were initially created by 5 of the largest organizations serving Chinese and Asian Americans in San Francisco to give a voice to Chinese American health issues. And the I in NICOS actually is Chinese Community Healthcare Association. So CCHCA is one of our founding members. Today, our membership is expanded beyond those 5 to include more than 30 health and human service organizations throughout the city. So again, particularly grateful to CCHCA for funding this project that I'm going to talk about. But first, I wanted to share kind of NICOS' approach to community driven, community-led initiatives. So NICOS really was created in order to give voice to the community. And so it's fitting that in everything we do, we make sure that the community's voice is a critical part of all of our efforts and initiatives. So as you can see on the left, NICOS engages in all of these activities in order to achieve our mission, things like research, community-based research, or collaborations with wonderful partners like San Francisco State, coalition building, advocacy, training, education, and program implementation. Some examples of NICOS grassroots from the ground up community-led programming include things like our Chinatown Disaster Preparedness Committee that we've been running since 1989, shortly after the Loma Prieta earthquake, or the Chinatown Task Force on Children's Oral Health since 2015, and more recently, the NICOS COVID-19 network since the pandemic that has been that has allowed us to do a lot of collaborative work to address COVID in San Francisco and in Chinatown particularly. So a quick overview of the God Game project. The God Game project was something that was born out of our collaboration with CCHCA, but a lot of the groundwork for that actually preceded the collaboration. So for example, in 2016, in a really wonderful research project with San Francisco State's Asian American Studies students, they actually came to NICOS for help to collaborate on a project where they wanted to find out what percentage of the Asian American student body may have gambling addiction. But in addition, they also wanted to find out whether gaming addiction was something that was prevalent as well. In fact, the lead student on the project actually struggled personally with gaming addiction. And so he had a particular interest in examining that. The research actually found about 22% of the API students at SF State could potentially have some kind of gaming addiction. So that was really alarming. From there, we actually did more anecdotal information gathering from local schools or children's service providers and found that there was a growing concern about how much screen use our Chinese American children are engaging in every day and how it's impacting their health. So in 2019 through 2020, we applied and successfully received our grant from CCHCA to create the Got Game project. And so Got Game actually stands for Gaming Over Time, Gaming and Media Use Education. So in August of 2020, we convened 2 Got Game advisory panels with experts who know about this issue in order to develop our project. And for the rest of the slides, I'll talk about some of the approaches and ways that we accomplished our grant goals. I'm also happy to report that as of this fiscal year, starting in July 2022, and thanks to the foundation that we were able to build with the support of CCHCA and the AAMG, we were able to receive San Francisco Department of Public Health funding to continue our work. So it's really important before we create any programs or interventions to have data, right? We just heard from Professor Wen-Wen about how important it is to gather data and to have research inform what we do. So during all phases of program development, we really emphasize how do we amplify voices of those who are not usually heard. So for example, we supported the research inquiries from those people who are most impacted by the problem, from the college students themselves who sought out NICOS as a partner in order to fulfill their school requirement, which was a research project. But ultimately, that student also ended up going on to, I believe, publish the results, which was really exciting. We also engage our community partners so that in addition to the data that we had, we wanted to know more qualitatively, how is this impacting young people? So we heard, for example, from Gordon J. Liao that weekday screen use had gotten so bad that a lot of the kids were not getting enough sleep or having poor quality sleep, that it was affecting their schoolwork, to the point where the school actually had to institute a memo for parents about about the importance of limiting weeknight screen use. So from there, we also recognize that it's important to use data while we are implementing the project. So throughout each phase of our program development, we would ask for feedback from the community. Youth, teens, and immigrant parents all had opportunities to review our materials and curriculum and give input. And the data that we collect from our workshops, like evaluations and client satisfaction, all help to improve the program on an ongoing basis. It kind of gives us ideas of what are we still missing in the curriculum? What else do we still need to develop that can be helpful for parents and for children? It's also important for us to build coalitions and to have stakeholders at the table, because we're not experts of everything and we don't know everything. So during the process of developing this program, we wanted to develop an advisory panel that would help us to design interventions that are most effective. So as you can see, we had a lot of partner organizations that serve children in the Chinatown and Chinese community in San Francisco, like CYC, who is joining the call as well, and many who have subject matter expertise, who are therapists or psychologists or pediatricians, to help us develop our materials. So you could see on the right, some of the suggestions that they provided in those meetings included recommendations that NICOS should take a harm reduction approach because it's impossible for young people to grow up without media, without screens. So how do we live with screens, but also establish balance and boundaries and promote overall wellness? And there was a push also for NICOS to really look into developing curriculum around how screen use is impacting the brain development of young people. As we started to develop programs, I kind of mentioned this already, it's important to involve subject matter experts and the people who are going to be impacted by the intervention the most. So parents and youth were all part of that development process. It's also important to hear from the community, how do we best deliver the interventions and education? So it's not just about us going to, places that we've already been, but it's about hearing, how should we deliver this? In what places are people most needing to hear this information? And every time we go to a workshop and we get a very, very difficult question that we can't answer, that's really a hint for us to say, we need to develop more materials. We need to use this as a program improvement to be able to expand on what we develop. So I wanted to show you some examples of the tools we developed. We have a bilingual family media use plan that is focused on different age groups. So there are different suggestions for preschoolers and for people who are in kids who are in elementary school to middle and high school. And so this provides some suggestions on how families could establish boundaries and create screen-free areas or zones and times. We also develop bilingual brochures that actually have a lot of information within. So you could see on the right side, there's already an example of the family media use plan in there. There's also a kind of a symptom checklist for parents to know whether their children may be impacted by screen use. On the very left, you could also see there's kind of like this is from the American Academy of Pediatrics on recommendations on what level of screen use is appropriate for different age groups. So this is available through NICOS online and also physically at our office. Finally, also under education, we do two main kinds of education, capacity building, where we train service providers, people who are doctors, nurses, therapists, to know what signs to look for, what are the symptoms of gaming disorder, and what resources are available to make referrals. But we also do a lot of direct consumer education. We conduct English and Chinese language education, both in person and virtual. Some of the things that we have planned include also developing media campaigns like video PSAs and using ethnic media to get more education out, and other ways such as using community health workers or peer educators, maybe young people teaching other young people, so that it's more accessible. Here's some pictures of us conducting education at different schools, both in person and virtual. During the pandemic, a lot of our workshops were forced to be virtual, but as soon as schools started to open up and inviting guests, we were there meeting with the students in person, which was great. Advocacy, it's also important that NICOS continue to advocate for needed resources. So we worked with a group called API Council to successfully advocate for funding from the San Francisco Department of Public Health so that we could continue to address the issue of gaming and screen use among the Chinese community, which is not going to go away, right, after the pandemic. We also feel it's important to take informed positions on local, state, and federal legislation that could impact how young people could access gaming or online activities. For example, Proposition 27, which was trying to expand online gambling in California, is something that NICOS took a position on. So in conclusion, NICOS' approach to community-driven programming is to support and empower, making sure that those who are most impacted by these health issues are part of the solution, So they're part of the research to help inform how do we conduct the research. It's a very community participatory kind of approach, right? It's also important to engage community members and partners to make sure that they play leadership roles in each phase of program planning and implementation. So for example, we had high school students who are actually part of our advisory panel because a lot of our work is going to be to students. So it was important for us to have people as part of the decision-making process that would ultimately also benefit from the interventions. Finally, our interventions have to be appropriate to the people that we're serving. So it has to be easy to access with minimal barriers and in a way presented linguistically and culturally appropriate. Finally, it's important for us as organizations to engage in advocacy because policies can shape the environments in many ways that either promotes or discourages health and recovery. So this is my contact information. I'm happy to put that in the chat later if it's helpful. I'm also happy to discuss more with anyone offline. If there's any interest in the Got Game project, we're happy to deliver educational content to organizations who can host us. Thank you so much, Esther, for the opportunity. I'm going to pass it back to you.
Thank you so much, Michael. Yeah, it's a wonderful Got Game program. We CCHCA are honored to fund this project. So yeah, we learn a lot from you and hope that people continue reach out to you and disseminate those resources that you have created so far. So the next, I think the next speaker would be Sarah Wen. Sarah is Executive Director from CYC. And Sarah, are you here? Okay.
Yeah, I'm here. Except
Excellent.
I'm sitting in my car. Sorry about that. I'm running between meetings.
Oh, no worry. Yeah, we're glad to have you. And Sarah will be talking about participate in community coalition and lift up the voice of API to community. So you can take it away, Sarah.
Sure, thank you. I really hope this will be like a collective discussion rather than just like one side talking like me. I'm not as good as Michael to have the PowerPoint and everything so fancy ready. But I also see that a lot of participants actually are also the colleagues in our community. So you might have already heard of a lot of this before. So I apologize if you have to hear it again, but I think today I'm more taking a role as like a co-chair of the API Council, which stands for Asian and Pacific Islander Council. It's more like a story telling that why we chose to fully engage with the council and how I personally really see that help to live up the voice of the API community in terms of advocacy and also on policy issues. I think for, as you all probably know, I've been with CYC for a very long time, about 25 years. And I've been executive director for actually over 18 years. I think I still remember at the beginning of executive director, we find it very, very actually difficult or challenging to really communicate the need of our community to our funders, whether it's a government or foundations or like individual donors. And we started to really try to develop our own relationship with the mayor's office, with city county San Francisco, board supervisor, other city department, government heads. And it's just really over our head, how can we really handle all this different networking connection and how to really present the need. One of the challenges we always have is that there's still a misperception that Asian is doing okay. We always trying to advocate for the need of our youth, especially in the unified school district. And we find it always very hard because when we look at the school district data, it has always shown that API youth actually, especially Asian youth, I should put it that way, actually has excelled or more as a better performance compared to many other like BIPOC community. And it presents a very hard case to really show the needs of our really vulnerable community, especially in the SRO community, especially with the new immigrants who are English language learners, unless we have really segregated data from the school district to show that this pocket of population has a huge need for academic support or for other enrichment activities. So we go around and talk to school district, even talk to the data department and trying to really tear out or segregate data just for this pocket of population, and has been very challenging. The other challenges we have is that we only provide a picture of maybe just the youth sector. And a lot of time when we're trying to really advocate for the Asian community, it'll be hard to capture the picture from different divisions, including like early childhood or like seniors or like adults for workforce development for different sectors with a full picture. So a lot of time we really like having a hard time to advocate for the need. And I think in a sense like 2010 CYC and like community CCDC, Chinatown Community Development Center, self-help for the elderly, and a few concerned members, we really all come together and really share the challenges we have. And we have started to found the Chinatown Budget Coalition back then. And it's a few of us that start to group together under this coalition's name, starting to have roundtable discussion with the mayor's office, with the city county of San Francisco, and then also start talking to some private foundations. And we see that's really a huge need. Just 4 of us, we see many smaller sized organizations that also serve the Asian Pacific Islander community, that they also have this challenge to really knock on the door to get any lights to shed on them to show the need of the community. So the API Council was found around 2015. And then at that point, we also developed a very short, like a snapshot report to really showcase that there are actually major challenges in the Asian Pacific Islander community, especially related to poverty level and also the need for workforce development programming and also economic opportunities that will really help to our population to become sufficient. And then after that report, then we connected with like different funders, both government and also private foundation to present and kind of really hope to show them that there's another side of the API community that needs help. And also if we look at the national data, actually less than 1% of resources in the philanthropy world actually dedicated to the Asian community, even though our population makes it much higher than that percentage. So we're really working hard, and we also see many small organizations that they will not have the capacity or bandwidth to actually to do all this advocacy efforts at the policy level or with the funder. Just because as an executive director myself, I know how hard it is to really not to clone ourselves, and on top of working 24/7, still have to actually try to communicate and be advocate of our community. So when we first founded the API Council, we have a quite small membership of like about 12 members. And nowadays we have about 56 members in San Francisco, that they all have to be predominantly or primarily serving the Asian Pacific Islander population. And most of them are actually providing direct services. And collectively, we reach out to 250,000 members in San Francisco. And at the monthly meeting, we really, at the API Council, that's really providing the platform where we really talk about what are the trending issues, what are the issues that affect the API community, such as like this year, there's redistricting, there's like census issue. And I think most importantly, every year we collectively develop a list or a report to show what are some baseline services that we hope the city will continue to fund, to especially if they are expiring grants, how can we actually can advocate for the department to renew this grant to really defend the baseline service that we have for the API community. So that has been really a very major agenda every year for API Council to represent the 56 members and also to defend the resources to continue to provide vulnerable services to API community. For the first year that with the Budget Coalition, we started to looking into about defending or advocating for about $250,000 funding to, I think last year at one point during the COVID for the recovery fund, we're able to advocate for $30 million just to dedicate it to API community through the city and county of San Francisco. I think it really showcases how if all the agencies collectively come under one coalitions and really lift up the needs of the whole community representing different sector, it really make an impact on a lot of decision makers level. That's one thing. I think the other thing is very important is also through API Council that's also starting to have conversation and also have like roundtable discussion with other BIPOC community coalition, including like Mega Black collaboration, as well as a Latino task force, so that we can also also reach out to other BIPOC community to stand together to really fight for the resources that need for the most vulnerable in the city, especially to the people of color community. A lot of work that has to be done, but we can't really do it without everyone's participation. So even though we have 56 members, we really hope that different agencies that they will take up like leadership role, be active at the monthly meeting so that you can also bring concern to the steering committee, to the council, so that it will be focus of the discussion. On every month, we also have invite important decision maker to our monthly meetings to really talk about the vision, the agenda, and how API community can work closer to them. I remember one time we actually have the Human Service Agency Director that come to our meeting to talk about that. From our report, it's shown that Asian population have a high poverty rate. However, the enrollment to the CalFREC program or CalWorks program has been like disproportionately low. So we have a very robust and fruitful discussion to talk about why that happened and how we can do better outreach to make sure that our population will sign up, will benefit from the CalFREC or CalWorks program, which that they, because they actually will fulfill the requirement, and it's actually a right that they could have apply for that kind of benefit. So that's just one example how we have invited different departments and different collaboration or institution and come to really have a platform to have a fruitful discussion to talk about collaboration and how to improve the lives of for the API community. There's also many other API Council like agenda coming up. For this year, we have also advocated for the API Equity Fund. So basically this fund is about $30 million that is open for API community organizations that could, especially those who are interested to either purchase or actually to renovate for their own institution like space. It could be a new purchase, or it could be a joint partnership. It could be a major renovation if you own the building. So there's a lot more actually coming out through the advocacy with the API Council. But all of this didn't happen without the input of the members. So I think active like commitment and also participation in the council will always take us in a long way, especially for the San Francisco community. So it's just like kind of like a storytelling of what I've seen, why collaboration is very important, and also lift up the voice for the community. And I think as an executive director, how we need this kind of support from our colleagues, from each other, to really come together to become a one powerhouse that we can actually work together to advocate for the needs.
Wow, that's a really wonderful presentation. Yeah, thank you so much for educating me about the API Council. I have been hearing in a lot of leaders like Michael and other people. So I was always wondering, what is it about? Now you actually tell me succinctly, help me understand, like maybe we can all join and bring the issues. And I think as I'm running the health education and nutrition, it's also bringing diabetes awareness is a really, really big issue, and very few healthcare willing to fund it. It's because it's preventative care, it's nutrition and all that. It's really, really hard to get funding. So it would be very interesting to consider bringing the voice out those obvious issue, right? And maybe possibly we can all work together and improve the health of our Asian community. Thank you so much.
One thing I just want to add is also API Council will also help in terms of expand to do advocacy at the state level. We also work very closely with Assembly members that represent San Francisco district to advocate for the need for San Francisco. And we also in contact with different national collaboration or something that, or other organization that's similar to API Council to learn about their best practice and also to really get even more national highlights, especially during pandemic, that how COVID has hit the Asian community really hard, and also how that anti-Asian hate have really hit the community. So API Council could really be a channel also for us to reach out to broader community as well. So, but thank you for this opportunity. Thank you.
Yeah. So if anyone want to join and not so active yet, so could you send the group information or send me the information I share with anyone else?
Yeah, I think most members are here as well. Many of them actually are colleagues, but I'll have to send you the information, Esther.
Okay, sounds good. Yeah, I would love to learn more. because
Thank
I
you.
think we heard about it, but I wanted to learn more and possibly join.
And we need more health sector representative to join the council too. That has been, we've seen that has also a gap in our representation is also the health sector. So it would be great if we can connect.
Yeah, good. Because you mentioned about the $30 million. So I think another topic, you kind of touch on it. It's how to access the grant funding. So it sounds like some source of funding. So for possible projects, right? So those 30 million is not tapped yet. So it's still ready to be.
It has been in discussion already. So that's already there are some agency already is ready to submit the application, but we continuously advocate. So the door is not closed. It's always good to join the council to know what's up to date and see opportunities coming through. And also if you don't see and voice the need of it, so that the council will also consider it and also to put it as one of the priority for the year or for the agenda. So I think that's why I think it's very important for participation and also to work closely with the council director, catherine.wong, to really to tell her to share about your needs and what you see is a gap in the community. And that's something that the council will work on.
Sounds great. Yeah, thank you.
Thank you.
Sarah. Very good to have you. Yeah, you're a wonderful storyteller. Very good. So now the next, the last but definitely not the least, catherine.wong. Catherine is the dietitian, nutrition manager from Department of Public Health, and so she is actually on the roll, and she actually pre-record her presentation, but she's willing to speak a few words with us before we show her presentation. So you can take it away, Catherine.
Well, thank you so much. Can you guys hear me?
Yes, we can see you.
Oh, great. Okay. So I would just want to first thank everyone on the panel today for all the wisdom that you share with me. And I especially love to meet some of you that I haven't met, like George. Yeah, and I think I met most of everyone. And Sarah, I love to hear more about the API. So I just want to say that at first, Esther told me this is a 5-minute presentation. So I was very good girl. I limited to 5 minutes. And because I'm driving to Los Angeles today, I actually have pre-recorded that because just in case the Wi-Fi. But anyway, if any of you are very interested, or somewhat interested in our HEAL campaign, standing for healthy eating and active living, you can email me or Esther. I can send you our 120 pages of every year we do a reflection booklet of champion stories written by our interns, so you can understand our program a little bit more. And I'm also very happy that Vivian is also on the Zoom call with us, who works with me. She's a dietitian from the Chinatown Public Health Center. And I just want to especially thank Esther and CCHCA for believing in us and fund this Teen Heal project. I have learned so much from my youth. Well, I think the intern who is presenting with me that you'll be hearing later on, Juliana Chan, she started out as a senior from Lowell High School, and now she's in her second year at Cornell University in engineering. Very surprising, not health, which I learned so much from. I think most of my career, I think I know a lot of you, I mainly concentrate on, adult education, but I think in the last 4 or 5 years, I really think that I've learned a lot from my youth. So I also want to thank Andy, Chinatown YMCA. I think I saw Andy's name, for really believing in us and co-sponsoring this program with us. And thank you for Denise, who really take care of our, leadership training. We train them both nutrition skills, leadership skills, actually life skills. I think every year we add on something just to hopefully be able to help our young people to be academically, physically, mentally strong individual, preparing them to be an adult. So I think without further ado, maybe Esther, can you help me present our video, and then I can take some questions at the end. Thank you. Hi, I'm so excited today to share with you what we have learned from our program, Project HEAL, which is really training high school and college students to run the program to impact on youth. And together with me, I'd like to introduce my 4th year HEAL intern, Juliana Chan. Thank you so much, Juliana, for sharing with me. So next. So our program is an internship program empowering teens to improve their nutritional and physical well-being. And basically during the internship for 11 months during the academic year, they learn 8 nutrition skills, 7 leadership skills, and they participate in different health topics in our community Zoom clubs and college workshops. These are an example of the nutrition skills that they learned. And also we co-sponsor with Chinatown YMCA, and they help us to train our teens on how to deal with stress, getting to know themselves, how to use their voice, and in terms of communication skills. We also started to have our own interns. After they graduate, they come back and they share their life journey with our own HEAL interns so that they can help them in maturing their own thinking. And after they're being empowered on the different nutrition skills, we train them to serve the community. As you can see here, they serve by teaching classes in YMCA, Asian Women Resource Center, senior centers. They also serve in different health fairs and also bringing the messages of nutrition to different media interviews like KTSF or on Skylink. Now I'm going to have my 4th year intern, Juliana, to share with all of you how they're being trained, and then they bring what they know back to their own high schools to share with their own class. Thank you, Juliana.
So for the school HEAL clubs, HEAL interns are trained to sponsor their own HEAL clubs at their high schools. And after each HEAL training, they teach the nutrition skills that they learn to their classmates and also lead food demos and provide food tasting. This year, we've also implemented a support system run by mentors who have already had experience running a HEAL club themselves, who essentially helped train new interns to be leaders and to run their HEAL club. So during my 1st year, I was a member of the Lowell HEAL Club, and I was mainly a member. And during my 2nd year, I stepped up into a more leadership position and helped run the club along with my co-president, Nikki. And together we tried to help promote healthy eating habits and active living during the pandemic. Additionally, interns also learn how to make healthy snacks. So a Facebook assessment was done on needs for healthy snacks, and recipes were modified to meet the needs for teenagers. Funding was provided to each school for healthy cooking demonstrations so that they could teach fellow classmates on healthy recipes. And the main curriculum that was used was based off healthy recipes from the book Healthy Appetites, Healthy Eating Guide for Youth and Parents. And for the evaluation, interns' nutrition knowledge were assessed via an interactive game called Kahoot, where we could tell how they were performing and progressing knowledge-wise based off their scores. And so we were also able to provide additional support for interns who were struggling to grasp a specific concept. And if a knowledge deficit was identified, interns would receive training to ensure their understanding on nutrition skills.
Thank you so much, Juliana, for giving us a quick rundown.
So we're so glad that this year we're able to, through 54 high school club meetings, we're able to have over 670 encounters. And really, basically, our program is on empowerment, passion, and having the HEAL interns impacting others. Thank you so very much for allowing us to be able to join you through our recording today. Thank you.
Fantastic.
Thank you, Savannah, for joining us.
That's a great program. Thank you so much. I think Catherine wanted to remind everyone if you want a ebook about the Teen Healed, so she can send it to you. So it's great, amazing program. So I think the left of the time would be Q&A. So I want to see if anyone have questions for one another. So feel free to ask now. Anyone have questions for each other? So this is a very wonderful leadership program, and this is our first year, and hopefully we don't end here. I know that we have some changes with CCHCA. You might hear from the news. So we see there's a new management what would happen. So I hope that regardless what happened with CCHCA, I hope that I still in the community serving people like you, and we can continue doing the partnerships. So let me know how I can assist anyone in the community. So I really thank our 5 panel speakers and leaders today, and giving share a lot of best practices so we can all learn from one another. And I can see that people have already asking one another in chat room. So I think Michael, and then also I do to judge about how do you actually connect with the UC Berkeley IT experts, so those are great networking. Maybe we can do offline. Those are very good lesson learned, by partnership, leveraging the resource that we have in the community. And I really think Wen-Wen being here, and I'm sure our future CCHCA grantees may possibly doing projects like that, like publications projects. So definitely people later on can reach out to you if they actually doing research topics. So that's great. Anyone have any questions? And thank you, Andy, Monica from YMCA for attending this event. And let me know if you have any questions for the, for each other, so we can all connect it, So if we don't have questions, I really appreciate all the leaders today again for attending the meeting. So our CCHCA grant will continue running next year and the year beyond. And we're looking forward to working with everyone here. And thank you so much for your support and serving the Asian community. So have a good one and enjoy your holidays. Bye-bye now.